Hi everyone, welcome to the Homoeopathic Studio. Today let us understand what is ADHD in short and see a small case of ADHD which is treated with homeopathic treatment. ADHD is nothing but attention deficit hyperactivity disorder. As we all know it, it is a neurodevelopmental disorder and it is characterized by inattentiveness, impulsiveness, hyperactivity which is not appropriate for the child's age. And it can be predominantly of three types. First one is it is inattentive type, second one is it is hyperactive impulsive type, and third one is mixed type. So what is inattentive type of ADHD? As the name says, in this the child is predominantly unable to give attention to minute things. He is not able to follow simple instructions. He gets distracted very easily and he is not paying attention even to the things of his daily routine. What is meant by hyperactive impulsive type of ADHD? Again here, the child is hyperactive, he is impulsive, he is aggressive, continued jumping, running, roaming, all these things are seen which comes under hyperactive impulsive type of ADHD. And when both these features are present in a child, he is termed as mixed ADHD child. So let us discuss a case of ADHD which was treated with homeopathic treatment. This is a child of 5.2 years age who came to the OPD with complaints of poor attention span with a sitting tolerance of only up to 5 minutes. There was very poor concentration, poor eye contact, echolalia, which means repetitive speech. There was an inability to follow multiple instructions at a time. The child was by nature very obstinate and he would throw temper tantrums whenever he was contradicted, and he used to bang his head and hit hard when he used to get angry. The behavior at school, he was trying to hit children and there was a lot of aggression which was seen. He tends to pass stools only with his diapers on, and there was also complaint of bedwetting. So in the past history of the child, after the birth, he was brought up by his grandparents and father, as the mother was away due to her work priorities for a period of about 9 to 10 months. And if we get into the history of illnesses, this child had developed influenza and was seriously down with loose motions for 1 month, during which he was given a lot of antibiotics, and this had come up after his vaccination was done. And the general nature of the child is very affectionate and caring. Physically, this child is chilly. There are cravings for cold drinks and ice creams. And if we get into the mother's history during pregnancy, there is nothing specific. It is uneventful. And the physical milestones of the child are normal, except for speech, which had developed after 3 years of age. And in the family history, there is a family history of hypothyroidism in the mother, and the father is a known case of asthma. His grandfather and uncle were suffering with cancer. And my observations in the OPD, the child would enter the OPD with a smiling face, and whenever I would ask any question to this child, he would giggle, he would give irrelevant answers, try to give irrelevant answers. He used to use broken words and the speech was very disconnected. And it was also very unclear. There was a sort of shyness which was there on the child's face. Okay. So this case was assessed before treatment and after treatment. So considering the totality of symptoms along with the child's past history and the family history, we had prescribed certain medicines to this child, and there was a lot of improvement which we had started seeing within the first 2 months, and later on the improvement started continuing And now after 1.5 years of homeopathic treatment, we are able to see certain changes in the behavior symptoms. Like before, there was a lot of aggression and the child used to bang his head and hit others hard. Now it is only seen when the child is not given something which he wants. Otherwise, this symptom is not seen. There was striking and hitting kids at school. Now it is not seen at all. There was a lot of restlessness in this child, which has also come down and subsided. There were repetitive behaviors like hand flapping was seen, which has become very occasional now. And coming to the sitting tolerance was very poor. We have seen it was only for up to 5 minutes. Now the child is able to sit for up to 6 hours, and he's also cooperating at the therapy centers for 2 to 3 hours. Attention span, which was very poor before, it has improved now. The comprehension and understanding. The child could not even understand simple instructions. He was not able to follow multiple instructions. So now he is able to follow 3 to 4 instructions at a time. Initially, there was bedwetting which was seen. Homeopathic treatment has also helped to bring down this symptom. And he used to pass stools only with his diapers on. Now the child is able to go to the washroom for stools. In speech, there was echolalia or repetitive speech which was there. Now the speech has improved and the child is able to speak well, clearly, and proper appropriate answers. The eye contact has improved. There were certain sensory issues in this child, like sensitivity to sounds, where the child would close his ears. Now it is not seen after 1.5 years of homeopathic treatment. And there was also sensitivity to textures. Now this symptom has also subsided. So overall, if we see, we got a comment from the school teachers that he is much better than other kids in the class and there are no issues at all. And from the therapists that he doesn't need speech therapy or any special education anymore. From the parents' side, they feel that the child has improved with homeopathic treatment. And now only symptoms which are seen occasionally, that too when the child is left alone or idle. Otherwise, the child has improved dramatically after homeopathic treatment. So homeopathy has very good results in ADHD, even though it takes some period. It takes approximately 1.5 to 3 years of proper treatment with which we can help the child to improve in all the aspects. The assessment values of the child before treatment and after treatment have been given. So there was an overall improvement, and this is about ADHD.